and welcome to Aging Matters, a program featuring individuals who talk about aging-related topics of interest to older adults and their families. I'm Cheryl Beversdorf, your host. Aging life care management is a holistic, client-centered approach to caring for aging adults or others facing ongoing health challenges. An aging life care manager is a professional who specializes in assisting older adults and their families in meeting their long-term care needs. Care managers provide for their patients by matching patient needs with appropriate services. Today, my guests are Vanessa Bishop, a licensed clinical social worker, and Judy Grumbly, an adult nurse practitioner. Both of them are certified aging life care managers who represent the Mid-Atlantic chapter of the Aging Life Care Association. Vanessa and Judy will tell us what information families should know when selecting an aging life care manager for their loved one. They will also describe services life care managers provide for family members. And later on in the program, they'll be presenting a short demonstration of how an aging life care manager helps a family member decide and coordinate services needed to care for a loved one. So thank you, Vanessa and Judy, for joining me today.
Thank you so much for having us today.
Well, it's going to be a great program, and we're looking forward to learning everything there is about life care management. So, Judy, let's start with you. Describe to us what is an aging life care manager?
In short, an aging life care manager is a health and human services professional who works with families and aging or disabled adults. That is the short definition of what an aging life care manager is.
And tell us a little bit more. Obviously, in my introduction, you're a nurse practitioner and you're a licensed social worker.
Right.
So is that the usual kind of education or background that life care managers have? Do they have additional kind of work experience? Describe typical kinds of life care managers.
I would say it's a fairly new profession, about 35 years old actually.
Oh, really?
And
okay.
Traditionally, most aging life care managers, used to be called geriatric care managers, were nurses or social workers. And that still is the majority today. Social workers tend to be more often care managers than nurses, but that's beginning to change a little bit. We also have in the profession gerontologists, which is a career path that more and more people are taking. Psychologists, sometimes physical therapists, occupational therapists become care managers after years of experience. The background for being an aging life care manager or care manager, just to be short, the experience is usually at least a bachelor's degree, if not a master's degree in your profession, whether it's nursing or social work. Those of us who are nurses and social workers are licensed in our profession, and then above and beyond that, anyone who wants to call themselves a care manager and belong to the Aging Life Care Association has to be certified by one of two certifying bodies that are recognized by the Aging Life Care Association.
So how does an aging life care manager different from, say, a patient elder advocate?
Well, as Judy was indicating just a few minutes ago, it's the education of that aging life care manager. Again, bachelor's degree, master's degree, advanced degrees, could be a doctorate in the health and human service field. It's also the licensure of the individual, such as a licensed clinical social worker or a licensed nurse. It's the certification, certified care or case manager. And it's really having that area of expertise and several subcategories of care and case management. And we feel that that's what differs us from a patient advocate. A patient advocate could be a family member. It could be a friend with very little experience, good intentions, but very little experience and knowledge base.
Yeah, and it would seem to me that they would be less prepared in terms of facing all of the kinds of issues that I'm sure that aging life care managers are trained to
Absolutely.
to talk about.
Absolutely.
And there is really no formal training. Is that
Right.
at least in terms of like a patient elder advocate? I mean, it could be, but not necessarily.
Not
Correct.
necessarily.
Would you agree?
And one thing that I think it's important to know, it's the people who become care managers need to have had a number of years of experience working in the healthcare world, because part of what differentiates us, when you use the word holistic at the very beginning, what we do is very holistic. We are looking at all aspects of an individual's life, and that requires a fair amount of knowledge, which is hard to gain if you've just gotten out of school.
Sure.
Right.
Sure.
There are some exceptions for sure, but nevertheless, having background in hospital discharge planning, the home care world, those kinds of things are very helpful because you start to get a good picture of the medical world, which is a lot of what we do.
So let's talk about the types of services that aging life care managers provide. What do you do on a daily basis? What kinds of services do you talk about when you're meeting with a client for the first time? And in what settings? I think that would be important to add.
Well, we'll start with the settings. The setting is really wherever the client is, and the client is the aging individual, whether it's an adult who's disabled or an adult who is maybe having difficulties. And so that person, we might get a call and we might meet a family member or the individual in a hospital setting. It could be in the rehab setting. It might be in a nursing home. It could be in the individual's private home where they've been living and want to stay. I'm trying to think of some other settings. It might be an assisted living setting, or it could be in independent, in a continuing care retirement community. That kind of probably covers most of the places that we go and meet, but it's wherever the client is.
And are these patients, do they all have health conditions? I mean, or could it be, what do you find in terms of, like, what are the circumstances where a family or a caregiver might need a life care manager?
Well, let me think of, I'll talk about 3 different circumstances that probably crop up more often than not. Oftentimes, family members who are the caregiver for somebody with dementia will come to us because they are at their wits' end, they're beginning to get burned out, they're very stressed, and they really need support but don't know where to go. So I think that is one pretty typical scenario. Another is a home safety issue for that aging parent. So we work with a lot of the baby boomers who are concerned about their parents who are now aging, want to age in place, and the home setting is not safe any longer. And so we will sit down and do a full, very comprehensive assessment. So assessment is a very big part of our job. It's very comprehensive, and that usually takes a good hour to 2 hours, sometimes longer, gathering all the information that you need in order to come up with a care plan. So assessment is one of the services that we do. We also work as advocates for our clients, whether it's on a short-term or a long-term basis. We do crisis intervention. We help with placement of individuals who are no longer appropriate to be living in the home setting, where it's very unsafe, and we try to find an appropriate setting for living environment for that individual.
So you're trained to be prepared for any kind of circumstance when it comes to this older adult.
Yes,
Would you
that's,
agree?
we wear many hats.
And I think to that point, because these are older adults, does Medicare and other insurance pay for these services? And also, what about long-term care insurance?
Right.
What's the situation there?
Medicare and the health insurance does not pay for an aging life care professional. However, some long-term care insurance policies will reimburse for care, case management, and aging life care professional services. You just have to, on each policy, look at the verbiage confirm whether or not they do reimburse. This is, again, regarding the long-term care insurance. And a number of them are reimbursing an allocated amount per that long-term care insurance company.
Is it likely that that might change? That, I mean, it sounds like it's a very important part of the health team, if you will.
It would be ideal if our health insurance paid for an aging life care professional, again, care or case management. I see quite often long-term care insurance policies reimbursing, but it's at a capped amount. There's not an unlimited amount that they reimburse, but at least it's some.
Well, every little bit helps.
Right.
Okay, well, let's watch an interaction between an aging life care manager and her client. In this case, it's Mrs. Stewart, who is, the two of them are working together to develop a care plan for her husband, Mr. Stewart, who was diagnosed with moderate dementia 2 years ago. Now, Mrs. Stewart has a full-time job outside the home, and she's concerned both about her husband's risk of falling when she's away and his increased loneliness and social isolation. So let's watch.
Good morning, Mrs. Stewart. My name's Judy Thomas, and I'm an Aging Life Care Manager, and thank you so much for reaching out to me today to come to your house and talk about what's going on with you.
I'm really glad that we could meet. I'm just been overwhelmed and worried and just don't know what direction I should be going in regards to my husband.
All right, well, let's just start off and tell me a little bit about what has been going on, so I have a good idea.
Well, my husband approximately 2 years ago was diagnosed with dementia, and I would say, and his neurologist has stated that he's in the moderate stages of this disease, which I understand is progressive. He also had a hip replacement 2 years ago, and I'm becoming worried about his gait and his mobility. You know, I work, I have to work Monday through Friday from 9 to 5. I'm worried about that. He has hypertension, he's had bladder cancer, I'm questioning his vision. Depression, I think there's depression. He's home alone. I don't know what to do.
Okay, and so it sounds like you're really worried at this point. One, he's at risk for falling because he's had his hip replaced, and he's all by himself all day long. And you need to work for financial reasons, or are you working for because you need to have a life also?
Well, I need to work for financial reasons. My husband is significantly older than I am, so he's retired, and I'm the sole provider of the family, and we can't live off of his income. So I need to work. I also am feeling burned out because I'm the only caregiver. You know, when I come home from work, it's more work. And I just don't know, again, am I doing the right thing? So.
Okay. Are there other family members in the area that visit periodically or that can help you in any way during the week?
We have a son, but he's not local. So he'll call and check in. We have friends, we have some neighbors that used to visit more often, but because my husband's memory isn't as good as it used to be, his short-term memory is really starting to fade. I've noticed, and he's noticed to a degree, that they're not calling or coming over as much anymore. So we have some, but not a lot of support.
Okay. So trying to get a very good picture, he's got some medical issues. Dementia is the one that probably overrides a lot. Maybe the hip replacement. Has he had any falls in the last 6 months?
He hasn't had any falls, but I noticed that his left foot is starting to turn inward. And I was questioning, is that affecting his gait or his mobility? I don't know. Also questioning his vision, his depth perception. But knock on wood, no falls, but I know that we can't guarantee that we're not going to fall.
Does he use a walker or any kind of assistive device, walker, cane, anything like that?
We have a walker. I would love for him to use the walker more often. It's a little bit of a challenge. He still wants as much independence, at times a little denial in possibly needing to use the walker for his benefit. We do have a stair lift in the house that he'll use when I'm there. I don't know if he uses it when I'm at work, though.
Okay. And tell me a little bit about who manages his medications. How does that work?
So I do all of his medications. I pre-fill them, and I'll give him his morning meds, and I'll leave out his noon meds, and then I will give him his evening meds. But I'm the one calling the doctors, getting the prescriptions refilled, picking them up, and filling the pill boxes.
Okay. And is he able to prepare a simple lunch for himself while you're away at work?
Simple meals he can still do.
Okay.
Sandwich,
Okay.
vegetables. Sometimes I might slice up an apple before I go, snack he can munch on, but nothing complex. I don't want him using the stove.
Okay. And in terms of just trying to think about, a plan of care to bring you some support, looking at activities of daily living, things like being able to bathe and dress himself and brush his teeth, those sorts of things. Is he pretty independent in those things, or what areas does he need a little bit of assistance?
He's pretty independent still in being able to dress himself. But what I notice is in the morning I might have to cue him to brush his teeth. But he's independent with his mobility, and he still can transfer. He still dresses, but there are times where I feel like I really should be supervising him. If he's in the shower, I typically want him to shower when I'm home, fearful of falls.
Yeah, okay. There's some things that I'm thinking of that I think we can do fairly easily that might put your mind at ease. There is a Lifeline program that operates out of the local hospital.
Oh.
And somebody would come out and set up the system for you. It's really just sort of a little box, and your husband would then you can either wear something like a wristwatch or something around your neck that has, the new ones these days pick up motion sense. They have motion sensors, so if there's a fall, and the individual maybe is unconscious or for whatever reason can't really speak, the sensors pick up the fall and automatically contact the hospital, who will then say, "Are you okay?" And if there's no response, they will send the ambulance immediately.
Oh, fantastic.
So if he were to have a fall on a curb or something, it would send off the signal too.
Oh, okay.
So.
Okay, great.
So that's one thing I'm thinking of that might be beneficial. There is an adult day center in the area that might benefit both of you. Now, I'm not sure your husband would be willing to go along. It specializes in dementia. All the personnel who work there are trained in dementia care, how to communicate. They work with all levels of dementia, so early onset, early stages, moderate, and even late stages. They have a nurse there during the day, many activities.
Oh, he'd love that.
The minimum number of days to go per week are 2.
Okay.
And they also offer support groups for family members, lots of educational sessions, so it would benefit you also because you would be able to be in a group with other people within a similar situation,
Right.
which I think would be a very good thing for you.
Yeah, you're absolutely right.
Because this is a two-way street. We're working with both you and your husband, and so we need to bring supports for both of you. There is another program. It's a senior visitor program where we match people, adults who have had professional careers. Sometimes they are stay-at-home moms or dads, or people who have retired who like working with an older population. And they'll match an individual up with some of your husband's interests, which we haven't talked about yet, but maybe we'll get around to that.
Okay.
And that person can come a couple days a week, and they can go on outings for walks, things that will give him move him out of his isolation.
Oh, that sounds
And,
wonderful
you know, that might be a good first step. So that's something else I'm thinking about. Last but not least, I'm thinking that because of that weakness that you're talking about in his leg, that it might be a good idea to speak with his doctor and maybe get a doctor's order for some home therapy.
Okay.
Because he can't drive, he's considered homebound, and it's a benefit that Medicare covers.
Okay.
Medicare Part A will cover skilled home care, and you can have the physical therapist come to the home and work with him on some exercises that might strengthen that leg and give him better balance.
Okay.
So his fall risk would go down.
And could they go throughout the home and check the home for?
They will do an evaluation for safety things in the home,
Oh, that'd
recommend
be great.
places where maybe you should have grab bars, that sort of thing.
Oh, that would be really helpful.
So, and that would require a doctor's order. Now, most of these things I can make the referrals for you if you wish. What I'll do after our meeting today is it would be good for me to come and meet your husband, because that will be really helpful to get a sense of who he is and what his interests are, and we can talk about that. Then I'll write up a plan of care for you, which I'll send to you, and if you want, I can make the referrals for the Lifeline and the physical therapy and that sort of thing. And then those individuals will be in touch with you. What do you think?
Oh, it sounds, I already am starting to feel some of my anxiety lessening just listening and having you come today. I really appreciate your coming by.
Good. Well, it's been a pleasure meeting you.
Thank you.
Yeah.
I hope that you enjoyed watching the consultation between Judy Thomas, the Aging Life Care Manager, and Mrs. Stewart, and how she gathered information from Mrs. Stewart to talk about what the needs and services would be for her husband. So this is a pretty accurate portrayal of the process that goes on between an Aging Life Care Manager and her client. So we have to have a few more questions just to clarify. And Judy, we're going to start with you again. Can families actually call Aging Life Care Managers in a client emergency? What would be the circumstances where an emergency situation would be appropriate for a life care manager?
Absolutely. I will answer it in a little bit in two parts.
Okay.
Some care managers are more consultants, and they strictly have their practice 9 to 5. But many care managers, even if they're solo practitioners, will take emergency calls for their clients and always will have a backup person so that they can periodically go on vacation or perhaps not be available one particular evening. So there is a backup person that their clients can call in the event of an emergency.
Okay, so and overall, if there's a relationship then between a life care manager and the family, what's the length of time does that occurs when you sign the contract? I'm assuming there's some sort of contractual agreement. Is it a month? Is it a week? Can be a long time? What would you say?
It could be any of those, actually.
Okay.
After you sit down and meet with the family, you sort of come to a conclusion about what the family's actually looking for. And it could be that they are in a crisis situation with something that's going on in the family, and they're asking for your help to stabilize the situation. And that might be very short term. It could be a week, it could be a month. Until all the pieces are in place and the situation is stabilized, and the family may say, thank you so much. I don't think we need your services any longer, but we might give you a call in the future as things change. So that would be one scenario.
Sure.
Another scenario can be having a client frequently who has no family, the term that's being thrown about today, elder orphans. These are very old people who may have no family members left, never married, never had children, that sort of thing, and they really need an advocate. And for those people, you become the son or the daughter, and you might have them as a client for 5 or 10 years.
Wow.
Yes,
Wow.
and attend their funeral service, plan their funeral service. I have had a number of those in my time being a care manager.
It's just another example of why formal training is so important for
Absolutely.
an aging life care manager, because there are so many situations you really have to be flexible. That said, though, Vanessa, what happens if it's not a good fit? That there's been the assessment, such as we saw a little earlier, but as time goes on, either the family decides it's not a good fit, or even the client himself or herself just there's just a clash. What happens then? How do you handle that?
The care manager would want to sit down with the family or sit down with the client to fully understand the reason for why it might not be a good fit. And there are situations where it's just not the right match, and we do refer out to another aging life care organization. But the client and the family member at the end of the day does have the decision as to whether or not they're comfortable with the services. They might not be ready to face the reality of the situation, so they want to terminate services. It's really...
It could be any kind of possibility.
It could,
Yeah.
and we do have a strict code of ethics and a standard of practice that we do need to abide by within the Aging Life Care Association as aging life care professionals. So we certainly keep that in the back of our minds when we have a situation such as this.
Yeah, I mean, so it's more than personalities. It's so many. It can be a situation, I assume, with the client itself. They're not, as you said, they're not ready to
Right.
face the fact that they need a manager. So, so I guess the best final question would be, where can people find out more about aging life care managers? Obviously, we have our banner here.
Yes.
Talk a little bit more about how people can get in touch with your association, the National Association, and even other resources.
We have a national website, and anybody can go to aginglifecare.org.
All right.
And on the website, there's a section where you can click on it and find an aging life care expert and actually enter in the zip code of a location, and you can say within a 25-mile radius, a 50-mile radius, you can say whether you want an advanced professional, a professional, and it will actually bring up aging life care professionals within that 25-mile radius, which
Excellent.
is absolutely wonderful.
Excellent.
And it will indicate the areas of expertise or concentration that they practice in, their degrees, their licensures, website, and contact information.
Okay.
So we strongly refer people to the aginglifecare.org website.
Well, and you've got chapters all over the country. So
We do.
People can watch and look for somebody in any part that they want.
Absolutely.
Absolutely.
Yep.
Well, I want to thank Vanessa Bishop and Judy Grumbly with the Mid-Atlantic chapter of the Aging Life Care Association for joining me today to talk about aging life care. This program is broadcast Sundays at 5:30 p.m. and Wednesdays at 6 p.m. on Comcast Channel 69 or Verizon Channel 38 in Arlington, Virginia, or it's streaming live at those times on www.arlingtonmedia.org. Aging Matters is also on the radio. The program is broadcast every Tuesday at 2 p.m. on WERA-LP Arlington 96.7 FM. And you can listen to all of the previous Aging Matters programs by visiting www.mixcloud.com/Aging Matters. And finally, both radio and television Aging Matters programs are posted on the Facebook page, www.facebook.com/Aging Matters WERA. Thank you so much for watching Aging Matters today, and until the next time, remember, age is just a number, not a label. I hope you can join me again on the next Aging Matters program.